So we know through the modelling that was undertaken by the Doherty Institute, roughly the numbers and the different scenarios that we can have around being able to plan for the numbers of COVID positive people. As you know, most people will be cared for in their community, but as a hospital-based system, we have to plan for that 5% of people that we will be able to offer care for here.
This includes ensuring that we have the appropriate setups in our emergency department to manage any COVID patients that may require emergency care. Also our acute care, so anyone that may require an admission to acute bed, and we've got our flows and pathways in place to make sure that we can manage that. As well as our intensive care. For those patients that may require a higher level of care, it is our role to make sure that we are ready for that, in that we've got suitably trained workforce and staff and processes in place to manage.
So the first thing we do to make sure that we're operating a safe site is to ensure that our staff are protected. The best way you can do that is by vaccination, and we know that our staff rates are now above 90%, and we're really proud that our staff have really done the right thing. We also have been opportunistic about making sure some of our vulnerable patient groups, such as our renal patients, our cancer patients, are vaccinated as well.
The Royal Adelaide Hospital is an extraordinary world-class facility, and we have the advantages of having 100% single patient rooms. This has given our organisation that extra level of protection for both staff and patients. We also have negative pressure, so all the airflow is sucked up and not pushed out into corridors. We also have adequate PPE. We have over 8 million masks available in our current stockpiles, so we don't have to worry about running out of those. We have infection control nurses come around regularly to make sure that we're up to date with any changes that may have been seen.
ICU has been preparing very hard. We have been preparing for the last 2 years overall, so in preparation for the initial wave, the second wave, and now this potential Delta outbreak. We have been integrating with the activities within the state and within the other networks as well. And more importantly, we have been collaborating with similar ICUs in New South Wales and Victoria who have been through this problem.
And the final role that we really play in this COVID response is the COVID Care Centre, which is around assuring that we have an appropriate place for assessment and treatment of patients that are being managed in the community, but that do not require either emergency care or admitted care in our hospitals.
So the COVID Care Centre is established with a multidisciplinary team, so looking at specialist medical, nursing, allied health, pharmacy, coming into a supported environment for COVID positive patients.
They'll be referred to us by either the GP assessment team or the COVID response care team, which will be looking after all of the COVID positive patients in South Australia. So essentially, once you're COVID positive, you're in their safe hands. And then if you have a condition that needs face-to-face care as opposed to telehealth, but you don't need to go to the emergency department, then you come to us.
So I'm really proud but also confident in the planning that we've undertaken, the way we've reached out to others to learn, but especially I'm confident in our staff because we have a building that is unlike any other building in Australia at the Royal Adelaide. We know that in fact it's been purpose-built to be able to respond to a pandemic. We can change our airflows, we can compartmentalise any part of this building, and how lucky are we? So for the people of South Australia, we are here when you need us. We have a building that will keep you safe. We have staff that are skilled. We're absolutely ready to go.